For thousands of older people throughout New England, paid caregivers are a lifeline. The problem is that the need for people who provide care is much greater than the supply. Up next, we'll look at some solutions to that problem. Welcome to Call to Care, New Hampshire. I'm Jennifer Rooks. It is no secret that New Englanders are aging. New Hampshire, Maine, and Vermont have the nation's highest median age, according to the U.S. Census Bureau. It's estimated that by 2020, in New Hampshire, 1 in every 5 residents will be 65 years or older. It's good news that we're living longer. What's not so good is that there is a rapidly growing need for paid caregivers, but not enough people to do that caring. In this program, we will show you what paid caregivers do in our communities, the problems they say they face, and some of the solutions to those challenges. Joining me are Rebecca Hutchinson of the New Hampshire Alliance for Healthy Aging, Doug McNutt of AARP, Roger Morier, a direct care worker, and Roxy Severance of the New Hampshire Sector Partnership Initiative. The best way to understand what caregivers do is to show you. We'll start with Peggy Druin. She began caring for her elderly neighbors when she was 8 years old, informally, of course. Peggy's neighbors are long gone, but her passion for caring is still very much alive.
Hi, my name is Peggy Druin, and I am a caregiver, and I've been doing this kind of work for about 11 years for Essentia, going in and out of homes each and every day, about 5 days a week, doing a little bit of everything, and loving what I'm doing. Hi, Dan. I've been with Dan since November of last year, right before Thanksgiving. If you want something to eat, I'll go get you something to eat.
She's delightful in my eyes. I think she's awfully good. She's a warm, caring, very bright woman.
My mother was an LNA her entire life, serving the Merrimack County Nursing Home herself.
I've had at least 4 verifiable strokes.
Would you like me to hold the dog while you eat?
Life has just changed so much. It's nowhere near as much fun as it used to be. My wife's name was Lynn. Lynn Larley, 38, I think, or something like that, when I met her. But it was nice. It was a good fit. I get quite depressed at times. I've never lived alone before in my life. And at my age, that's a long time. And she keeps me as organized as I can get, I guess.
He needs medication reminders.
She helps me get to appointments.
He needs his bathroom cleaned thoroughly, his floors washed thoroughly.
Grocery shopping, laundry.
He needs his laundry brought to the laundromat because he doesn't have a washer and a dryer.
It's tremendous. She doesn't come on the weekends, and basically I sit here for 2 days. I wouldn't be able to do anywhere near as much as I fortunately get to do now.
I have absolutely seen changes in Mr. Howard. Yes, I have positive changes. His attitude is much more positive.
What should we ask Peg to help us with?
Than it was when I came in November. He's much happier. I've seen him outward laugh and smile and look on the bright side of things much more and participate. He's participating in life again, willing to get up and to go out. I believe I make $11.20 an hour. I could use a little bit more in my pay. If I had more in my hourly wage, I could cut down on the hours that I work, because I work a crazy amount of numbers to compensate for my income.
I feel blessed to have somebody as bright and big-hearted as Peg is that comes to help me. It all starts with the heart.
This is a win-win situation. I wake up every day and I get to go see the people that I love just as much as I love my family members.
Roger Moria, you are a direct caregiver like Peggy. When you saw her piece, did that resonate with you?
Absolutely. She embodies everything that I feel about being a caregiver today. I should mention that, unlike Peggy, I'm a newcomer because I've only been at this for, it'll be 3 years this coming October. I truly feel that I get back as much as I give as well.
Rebecca, tell us about the different kind of paid direct caregivers there are.
Sure. There are many titles in the state of New Hampshire and across the country. There is a licensed nursing assistant, LNA. Sometimes that's called a certified nursing assistant, so you'll hear CNA. In New Hampshire, there's something called a personal care service provider. So there's really about, I want to say, 5 or 6 titles that go with the paid caregiver. Some of them are licensed and some of them are not, but they all provide care both in the home, such as Peggy, or in assisted living and other residential community nursing homes as well. So we're really talking about the level that's not RN, but doing the direct care.
Right. Doug, how important are these paid caregivers to the communities?
They're hugely important, both in the home setting and in the nursing home and assisted living, because for families, their family caregivers do quite a bit, and they can do a lot, but oftentimes they can't do it all, and they need some help, and then the ability to be able to get some support so that they can keep their loved one at home. And if it's in the facilities need the help in order to be able to do really good care for people.
Roxy, who makes a good direct caregiver? If someone's watching this program and thinks, maybe that's for me.
I think someone with a caring heart, someone who's a people person, someone with great customer service skills, and somebody who really enjoys making a difference in other people's lives. Like Roger. I mean, I think he really, like he said, he embodies that. He makes sure that when he leaves at the end of the day that the person has felt, that they were well taken care of, and that he gets great enjoyment out of that. So people who are kind of looking for to make a difference.
Do you see people with all kinds of backgrounds?
All kinds of backgrounds. Someone who maybe was able to take care of their grandmother in their home. Somebody who, I know in our area, they have people with called the Grandfriend program, and they bring in school kids into nursing homes, and some of those kids get turned on really early in life to talk about, to learn about caring for others.
Rebecca, I know you've been doing this kind of work and working with people who are in direct care for a long time. How has this changed over the years?
Well, I would say in some ways that it has not changed enough is that the pay and the benefits have not increased a lot. But to try to answer your question more directly, I certainly think there's more demand. That's absolutely true. As the baby boomers age, there is increasing demand for both those at home and in residential areas. But I think the actual tasks have not changed a lot. It's, these folks are the difference for some people of the ability to get out of bed or not. Sometimes they can be in their home, in their beds, until their caregiver comes and helps them. So the actual day-to-day work has not changed much, but the pay has not increased much in the 15 or 20 years that I've been in this work. So unfortunately, there are some things that haven't changed enough.
Roger, do you have an anecdote or a story that illustrates what this job means to you, or a favorite moment?
Oh, a favorite moment. Well, I have many of them, but perhaps I can answer it in this way. As a caregiver, we have certain tasks that we're more or less required to do. These are things that, daily living tasks that we have to do. But what resonates the most with me is if I can actually make a difference on a personal level with a gentleman. I had one client in Chester about a year or so ago, and one of the first things that the daughter told me. The gentleman lived with his daughter, and he said, Roger, she says, I know that you have certain tasks that you're required to do, but she says, if my dad tells you that he wants to go fishing, or he wants you to take him for a ride, or he loves gardening, so if you can get out there and plant a garden together or something like that, she says, just forget all about the tasks and just do that. So I think for me it's all about, it takes a few weeks and it takes a few times getting a relationship with each client, and they're all different. With this one here, it was almost instantaneous. I mean, he was lovable. He hated to hurt people's feelings. We just connected in so many ways. I was not at all a fisherman, but I was more than happy to bring him fishing because it made a difference. At the end of the day, I made a difference in his life, and that's what motivates me, really. So.
We've referred to this, and the reason we're doing the program really, Doug, is because there's a shortage of caregivers. How would you characterize that shortage? Is it steep?
Well, I don't have specific data, but we know from anecdotally from providers that there's difficulty in getting caregivers. And you know, it was just somewhere recently where people were talking about this. We're in New Hampshire, and our unemployment rate is 2.5% or whatever it is at the moment. Well, at McDonald's, if they need to get new staff, they can raise their wages. We have so many providers in the state who get public funding, and they haven't been getting increased funding, so they don't have that luxury. And so they really are relying on people like Roger who love to do the work. But at the same time, people need to make a living. So, you know, we really have that dilemma. We have increasing demand. We're not willing to pay more. It's sort of like in the old days with child care. We're not willing to pay. We think it's really important, but we're not ready to pay what it takes to really do that. And I think that's kind of really the dilemma we're dealing with here.
Rebecca, from the agency standpoint, what do you see?
I was going to say, I spoke with the head of an agency earlier this week who told me that she turns around, her agency turns down 20 cases a month, and that's a case which represents many hours, so many hours of care. That's one agency. I also was at a legislative hearing earlier this week, and one of the case managers will find the services for Medicaid clients, and he said that they have 300 hours a week that they can't service. So it is very severe, and as Doug said, in this time of low unemployment, it's worse than ever.
I used to say,
go ahead, Doug.
I'm sorry. I used to say we were saved by recessions. We'd have, and I think Roxy knows this. She ran a nursing home. There'd be times when, okay, when there weren't jobs available, we could get caregivers. But now, you know, we really are struggling because we don't have the ability to hire people at these wages. I mean, if someone can make several dollars an hour more and can have regular hours, can not have to do some of the difficult tasks, it's difficult.
Roxy, what kind of pressure does this put on the healthcare sector overall?
Well, I think a lot, because that what we're trying to do is to figure out how to get more caregivers and to cover some of these deficits. I know, nursing homes, hospitals, it doesn't matter, home care agencies, there's just not enough caregivers trained. So we're trying to get creative in how to do that and working together as an entire sector rather than just the hospitals looking for workers or the nursing homes looking for workers. Trying to offer training programs and incentives so that people want to come to this profession. Working with high schools, I think, is going to be very important, and even working with younger than high school, the grade school kids, and getting them in healthcare situations where they might say, hey, that's a career I might want to choose.
Well, perfect segue for our next piece. Training programs can help bring more people into the caregiving fold. At Mount Carmel Rehabilitation and Nursing Center in Manchester, new LNAs work one-on-one with a mentor to build on their skills and boost their confidence. We met with two veteran LNAs who share their thoughts about mentoring.
Because, that feeling like I'm doing something good, I'm helping.
We've created a mentoring program, and they go through 6 to 7 week training to be a mentor. So it's train the trainer. So a new LNA will get paired with a mentor, and they'll do their training up on the floor after the formal orientation.
When I first started, it was never like that. I only got training for maybe 2 weeks, and then I was on my own because we were short. All right, I'm going to get your blood pressure, okay?
Uh-huh.
That looks good. You're going to live another 100 years.
Oh, God, don't say that.
Sometimes we think if you're trained as an LNA, then when you step out of school, then you really know how to do everything. And that's really not the case at all. So how are you going to acclimate? How are you going to learn your job or your role as an LNA if there's no consistency, there's nobody to follow you? You may get very stressed and end up quitting and thinking maybe it's not the right job for you because you didn't get the right training.
It's nice to help people. That's my thing. I always like to help people. How was your lunch?
Good, very good.
And when I take care of the resident, you feel happy. You're helping somebody. You have to be lovely and caring for what you're doing. If you don't got that, you're not going to be able to do your job.
If you're trained the right way, then by the time the end of the training, then you should be able to fulfill the job requirements.
That's where being with a mentor is key. So having a mentor and one person that you're training with helps you to develop a relationship with that mentor so that there's trust that's built, so that you feel comfortable asking your mentor questions.
We got a good teamwork. Everybody works together, the nurses. It is nice.
They're with someone that knows what they're doing, so they're going to learn the ins and outs. There is no guessing. No question is a dumb question. And even now, they still come to me, even if they've did the 30 days, the 90 days, they'll still find me and be like, hey, I have a question for you. Because I welcome everybody, and that's pretty much what the mentor is. Even if you're done training, you can find any mentor on the floor and they can help you solve something.
It's a grand opportunity to learn, to try it. My daughter, she tried. She told me one day, I want to be LNA. I said, go ahead, try it.
So having that one person that you have that relationship with helps you really to learn and be a better LNA and be good at it.
Check the temperature, come with me.
I think the best thing about the mentor program is that we make them feel welcome, we make them feel like at home, and they're able to grow.
That's why I think a mentoring program is really important.
Roger, what kind of training did you have when you decided to transition and become a direct caregiver?
Well, the agency, first of all, provided formal training for a couple of weeks prior to my first assignment. But in addition to that, the agency is very good at providing at no cost to caregivers. We have online courses at no cost to us, and they cover a broad category and range of skills or just adopting an attitude of respect and engaging with the client, just a very broad range, and those are really very well done.
So here we're talking about two creative solutions, mentoring that we saw in the piece, and also online courses. Rebecca, what are some of the other newer ways, more creative ways that we're trying to bring more people into this work, or help those and support those who are in it?
I think one of them is greater support programs. Mentoring, I think we usually think of that as when they first start off. But there are programs where they actually shadow people for a period of time and also are assigned to the caregiver so that if the new person has questions and is anxious, they have sort of a buddy that they can talk to. So it's sort of continual shadowing and support. In the world of home care, you're out there by yourself, and it is very important to have ongoing support. There are some creative things. There's something called in New York and in Philadelphia now, there's something called in some home care agencies, the Steady Work Fund. And what this does is provides funds for clients, for caregivers who lose their client. Maybe they are hospitalized, maybe they die, or a relative comes to visit for a couple of weeks and so they can't work. And so the Steady Work Fund, they actually get some compensation to make up for the fact that they lost their income. That's a very creative solution. I'd love to see a pilot program for something like that in New Hampshire.
Rebecca, are the services there for people who are willing to pay out of pocket and not through the publicly funded programs?
That's a great question, because no, it is not only those folks who are getting publicly funded services, but also those who are getting private services. There are shortages for them as well. So I think that's an important message for the community at large to understand, is the shortage impacts all income levels, whether you're paying for it directly out of pocket because the staff are not there.
Given this shortage, can family members be paid through Medicaid?
Yes. In the state of New Hampshire, we have a Choices for Independence program, and family members do have to go through state steps. But yes, family members can be paid to care for their own family, which is a great program. It's really essential toward us meeting the demand.
Doug, is there a solution, though? We heard in that first piece that Peggy's making $11.20 an hour. And so much, my understanding, and correct me if I'm wrong, so much of that money is because it's through some sort of federal program or state program that the person who's paying that person can't just give them a raise. How do we pay people what they deserve in the system that we have?
Well, it's a good question. One of the ways we can do it is by bringing a light to this. I mean, in this last session, we did raise some funding for home and community-based services as well as for nursing homes. Mm-hmm. So that's one start. The other thing is, I think we have to be creative. We have to do a lot of things. We passed a law a couple of years ago for accessory dwelling units, and that could be a place not just for what we used to call mother-in-law apartments, but it could be for workforce housing. It could be for a caregiver, a live-in caregiver. And so I think probably we got to do all these things at once. We have to increase funding. We have to go ahead and try creative solutions and do the sorts of things that will make it better. But there's really no one magic bullet.
How many people out there are like Doug, and this is, like Roger, and this is a second career, or maybe their spouse is working, so sure, they'd like to be paid more, but they're doing it out of love. And then how many people are there who are really trying to make a living as a caregiver?
I do think that it's important that we recognize that most folks who do this work are, I would say it's clear to say that most are single income families, are often women. So we have to do more about the pay. At the same time, we have to do more to encourage other folks to come into it, whether it's older workers or young kids coming out of graduate from high school. But the majority of the workforce are depending on this income tremendously, and the most of them want to continue to do it. We had, at the agency that I ran, we had some folks who would go to different jobs that paid a little more, and if they could, they would come back. I mean, that was very common for folks to go to manufacturing for a while, and if they could, they would come back because it is so incredibly meaningful and rewarding. I mean, who among us can know that we're the difference between somebody getting out of bed or not? In the clip where Peggy's client says, on the weekend she doesn't come, and so I'm just sitting here for 2 days. It's incredibly rewarding work. Families appreciate you, the clients appreciate you, so we just need to make it to be a job that people can afford to do.
Roger, what do you think needs to be done?
If I could add one thing to that, when I have conversations with friends and they know that I do this kind of work and they ask me a little bit about it, I think there's a misconception on their end as to what I really do. Yes, I do relate all the tasks that I do, and I think they kind of back away from it, and their response, and the response that I hear most frequently is that I could never do that. And then I just sit there in utter amazement and say, you know, we all live as families, we have grandparents that we've loved, and if we make the effort to connect and just treat these clients in the same way that we would treat our own grandfathers, grandmothers, aunts, uncles, whoever they may be, it's a labor of love. And yes, I understand that my situation is a little unique because I don't depend on that income necessarily. It's nice to have it, I don't deny that, but many caregivers, this is their primary source of income, so it is a struggle. But we need, I think, to try and address the misconception that this is difficult work. Yes, we work hard, and we have to establish relationships of trust, and that takes time to do, but that misconception is there, and if we could just somehow get through that.
Doug, what's at stake if we don't change the situation?
What's at stake is we've got an aging population, and we've got more and more people that need care, and we're not going to be able to provide it. And it's really going to, I mean, it's kind of at a crisis level now. It's going to get worse. So, you know, it's a kind of a public policy issue. Are we going to decide that this is important enough that we're going to fund it? I mean, obviously there are lots of other things we can do, but fundamentally, that's the most important.
And that's the final word. Thank you so much, all of you. To find out more about paid caregiving challenges and solutions, visit nhpbs.org/call-to-care. I'd like to thank our audience, our panelists, and you for joining us today. I'm Jennifer Rooks.